I'll go ahead and continue. Sorry about that. There was some sort of prompt that just kind of turned on. And so what I wanted to share with you all this morning is who HealthCare Partners is, go over a little bit about our services and support for consumers, for the actual patients, and why we are a top-performing medical group and why this speaks volumes to your clients, and what it means to you guys as agents. And then, as Emmanuel was saying, we do want to be able to develop partnerships with our agencies and agents, and so we'll talk a little bit about how we do that. Emmanuel, am I ready to get started?
You are. You just need to click the little box that says that you accept taking over the presentation, and there should be a little prompt that came up on your screen. Okay, do you see that, Ruby?
It's inviting me to download. Yeah, it's not letting me. You want to try it again?
Sure.
Okay, 1 second. I'm just downloading the app.
Okay, no problem. All right, guys, just give us 1 little second, and we'll be back on here. You know, guys, Ruby is a great resource. HealthCare Partners is one of the largest organizations, not only here in California, but they're in different parts of the nation. And they're absolutely incredible at what they do. They really do take that that model of having everything in one service area, in one building, and to take care of the beneficiaries. I myself actually use their facilities. I have one not too far from my house. So I like their way of doing business. I go upstairs and see the doctor. I go right downstairs and get blood drawn and get anything else that I need. So it's an awesome facility that they have there.
You know what, Emmanuel, it's not letting me. I don't know why. Do you want me to email this to you and then you can
yeah, sure. Yeah, you can email it to me and then I'll click through it. All right, guys. I mentioned that we're in an industry where not everything goes perfectly. This is an example. But we'll work through it. All right, Ruby, we're ready to go.
Okay. All right, let's try that again. If you want, Emmanuel, maybe click on the bottom, kind of, it blows up. It blows up the actual presentation. Is it right? There you go. You just passed it.
Right here?
Next to the mic. Yeah, right there.
All right.
All right. All right, guys. Let's try that again. So let's go ahead and do the next slide. So just generally speaking, we're gonna go over healthcare partners overview. We'll cover marketing support and services and some of the value adds that the consumers get when they enroll with a PCP and our general network. And then we'll discuss some of the growth opportunities and collaboration opportunities for 2015. Next slide, please. As I indicated earlier, I'm Ruby, and I manage the South region of Healthcare Partners. Can I get to the next slide? So today, you may all hear of us as Healthcare Partners. We're actually now DaVita Healthcare Partners, and we have basically several guiding principles, and our mission, vision, and core values are the following. The mission, so we're looking to be the provider, partner, and employer of choice, and on that note, we have been. We've been the top performing medical group for 10 years in a row. We have won the Employer of Choice Awards for several years in a row. In terms of our vision, we're looking to be the greatest healthcare community the world has ever seen. And Healthcare Partners in itself, the model, is in 7 markets today, in 7 different states. And with DaVita as our new mothership, if you will, we're looking to take the model and deploy it across the globe. DaVita is in several countries, and so we're looking to align both organizations and take them to other countries throughout the world. Our guiding principles, we're physician-led, we're patient-centered, and we're clinically focused. So what that basically means at the end of the day that our physicians make all of our decisions in terms of the clinical offering. And our core values are service excellence, integrity. I don't know if you saw a little footnote, but it was asking about audio, Emmanuel. Service excellence, integrity, accountability, team, continuous improvement, fulfillment, and fun. So I would like to extend the invitation to all of you. Following this webinar, if you would so kindly provide your feedback to Emmanuel in terms of if this was helpful and if you had any recommendations for us in terms of what information you need to hear about. We're hoping that we can continue to build on this and make this a good use of your time. Next slide, please. So Healthcare Partners was founded in 1992, and as I indicated earlier, we've been rated the top performing medical group for 10 consecutive years. It's based on, that award is granted to medical groups on 3 basic metrics. It includes the use of information technology, patient satisfaction, and clinical outcomes. So really together, what that means at the end of the day is coordinated care, right? Patient satisfaction, I think what that means to an agent at the end of the day means that you have an opportunity to ensure retention. So when you enroll a patient with Healthcare Partners, there's actually a track record that proves that patients are happy with our model and won't maybe pursue other medical groups or call you guys for support, which gives you the opportunity to focus on new business instead of lending your time to do administrative types of duties and troubleshooting. So that's the value that we find for clients and agents in terms of our model. We have low disenrollment, again, going back to retention. We are best in class referrals and claims, and again, this goes back to having been the top performing medical group. And our metrics are for quality are nationally recognized. And as I indicated in the other slide, we do believe we're the future of coordinated care. Next slide, please. So HealthCare Partners at a glance, I was mentioning that we're across 7 markets. We won't get into the specifics of all of these numbers, but really at the end of the day, what this tells you guys is that we really have the know-how to handle Medicare Advantage patients, commercial, Medicaid. We do specifically in Orange County, and basically we handle care for folks when they're babies all the way to when they're seniors, right? So we don't really focus on one segment, different from maybe other health plans / medical groups. We have the know-how to handle the entire family. We do focus on Medicare Advantage. In California alone, caring for 114,000, and HealthCare Partners total 308. We are the largest medical group today. And again, as I indicated in earlier slides, we have won for 10 consecutive years the top performing medical group. So not only are we the largest, we're recognized for quality. Next slide, please. You want to just go ahead and click about 5 times to give us just those different metrics. And then, do you want to just go ahead and click about 5 times to give us the different percentages there? I think one more. Yeah. So basically, at the end of the day, what this slide just tells us is that HealthCare Partners grows above the national average for MAPD. So in California, we grew at 1.99% above the Medicare Advantage, the national averages. And total for Southern California, we grew at nearly 5%. So we're really growing at a faster rate than the industry itself. That means that we're actually growing at a faster rate than other medical groups and even some health plans in some cases as it relates to Medicare Advantage products. Next slide, please. So coming back, so I took you guys on a kind of very broad perspective to look at who HealthCare Partners is from afar, if you will, that we're in several markets, what we represent as an organization to ensure that we're taking our model across the globe, that we're recognized for quality and all of that. Coming back to the local market here in California, we serve over 600,000 members in 2 main models. So Emmanuel earlier was talking about one model where it's a one-stop service center, and we have 48 of those offices. And then we also have IPA offices, so independent practitioner offices. So we have 48 medical group offices where some of those can be a full one-stop service center with some specialty services, lab on-site, even some radiology. Not all of them have the whole one-stop service feel. Most of them do. But then we also have the wraparound independent practitioners that contract with HealthCare Partners. And we have 1,600 contracted PCPs. And together with that network, we serve about 600,000 members throughout Los Angeles and Orange County. Next slide, please. And so just to give you a sense for the group side, so what I was talking about one-stop service centers, we call them group. And then the IPA, we just basically refer to it as an IPA. We won't get into all of the numbers, but just kind of quickly here, you can see that on the group side in San Fernando, we have 8 clinics. Los Angeles, we have 7, so on and so forth. In Orange County, we have 9. And then as it relates to the IPA, you can see that we have a really broad network of PCPs on the IPA side. If you look at Orange County, we have 300 IPA doctors. Long Beach, we have 86, and so on and so forth. So together, you can see that we have a very robust network. The advantage of this is really that your clients don't have to travel across the borders of their cities, if you will, to access care. They can really stay locally because we contract with key hospitals in these different areas in San Fernando and LA and Orange County. We contract with key hospitals and offer specialists that are local. Oftentimes we hear that some folks have to travel from, let's just say, Orange County all the way into San Gabriel Valley to see a specialist. With HealthCare Partners, we don't do that. We keep people in their local areas. Next slide, please. So this map here gives you a sense for where our footprint begins and where it ends as it relates to Southern California. We're divided into two colors if you see that, north and south. And earlier on, I introduced myself as manager of the marketing department for the south. And so that's that blue section area. And if you kind of picture that 105 freeway, it's more or less along that line, not very specific, right, but kind of along that 105 freeway is where we split off into north and south. The footprint from the north area kind of spans or begins, if you will, like by Valencia, more or less, and then goes all the way down into greater Los Angeles, kind of downtown, that whole area, and then spreads into the San Gabriel Valley. And then as it relates to the south, we have here the South Bay region, Long Beach, and Orange County, and we go as far south as about Tustin. That's really our network. We have some providers in the area of Irvine, but for the most part, we're north of Tustin. As it relates to our networks, they operate pretty independent. We still have the legacy regions 1 through 6. Some of you folks may recall that we collapsed about 2 years ago. We collapsed regions and created a north and a south rather than the numeric regions 1 through 6. And the vision and the reason for that is to simplify the network and simplify access for consumers. So the vision is that at one point a consumer should be able to cross the borders of, say, Santa Ana and go into different networks, let's just say Long Beach, should they prefer that. Oftentimes folks don't, but if they wanted to, we wanted to create those access points. Today, that's not the case. What North and South means to you folks today is that you get a concentrated team of marketing partners in these specific regions. So, and we'll get into who, I actually have an org chart here to introduce the marketing team for the North and the South. And as you are working or maneuvering or navigating through different areas, and if you have questions on the network and how to help your clients navigate, you now have designated folks that can help you respond to some of those questions. Next slide, please. So I wanted to provide some updates as it relates to the South region because there are quite a few. In the South, you may or may not know that HealthCare Partners purchased Talbert Medical Group about 5 years ago. And the way HealthCare Partners likes to go about rebranding acquisitions is very, very slowly. So that means that we honor the name of the organization that we purchased if it's a good one. And in this case, Talbert was a well-respected name in the community, so we honored the name for about 5 years. But as of late last year and now all throughout this year, we're undergoing a full brand transition. So you will not see any more Talbert Medical Group branded buildings throughout Long Beach or Orange County, which is where the Talbert sites are located. In addition to that, we have 2 IPAs in the Orange County region. About 3 years ago, Talbert launched its own IPA, and it was known as Talbert IPA with pods, and we'll get into those pods in a second. But Talbert IPA is also rebranded and is now going to be known as South Coast IPA. So anything that was Talbert, you will no longer see. So just know that as you start seeing South Coast IPA on different maybe health plan directories, know that that was the legacy Talbert IPA and is part of HealthCare Partners. So you should actually see it branded HealthCare Partners South Coast IPA in different health plan directories. Now, 2 years ago, we purchased Arda Medical Group. Some of you may or may not know that. Arda Medical Group was primarily a Medi-Cal IPA and is now, because of its alignment with HealthCare Partners, is now expanding its bulk to offer care to seniors and commercial. And with that, we will also be undergoing a brand transition. But today, Arda remains Arda, except that on the health plan directories, you'll start to see HealthCare Partners Arda. So just know that that's all part of our network. As it relates to hospitals in Orange County specifically, we now have a new partner considered a core hospital, and that's Fountain Valley Regional. And what core hospital really means is that that's where our hospitalists are employed. So the beautiful thing about HealthCare Partners is that when a patient is hospitalized, our hospitalists are employed and are actually stationed at that specific hospital. And that's how we keep the continuity of care, and that's how we've actually been awarded the top performing medical group for the 10 consecutive years that I mentioned prior, is because in these different hospitals, we have our systems, our IT systems are actually embedded in these hospitals, and we update all of our systems to include the details in terms of what's happening with that patient, what medications are being prescribed, the reason for hospitalization, the date of discharge, and the discharge plan. All of that goes into our clinical viewers and are made available to the PCPs so that the PCP is aware of what's going on with the patient live. He can actually go into the systems and know exactly what's going on with his or her patient. So again, Fountain Valley is a regional, Fountain Valley Regional is a core hospital now. So we've now expanded our partnerships in Orange County to include Orange Coast, Fountain Valley Regional, Anaheim Regional. And then the IHHA hospitals are no longer contracted with us, so that's the Santa Ana Western Med. That was an update about a couple of months ago. On another update, we have a brand new site, and we hope to be able to invite you all to a meet and greet coming up here soon. But the Fountain Valley location that was right on the Orange Coast Memorial Hospital campus has moved. It was a Talbert location that had been there for quite some time, and we renewed the lease, and we actually had to move into a new location that has better parking. We're pretty excited about it. It's a beautiful location, and as I indicated, we're going to be hosting a meet and greet for sales partners, and we'll make that invitation available to you either through Emmanuel or I guess another avenue. I'm not quite sure yet. So we'll get that date to you guys, and hopefully you guys can all come tour the facility and get to know our doctors as well. And then on the IPA consolidation. So I indicated earlier that we went through a brand transition for South Coast IPA. And what that means is that the pods that were attached to the IPA collapsed. So we had about 8 of them. If you look at the grid there that states before 12/1/2014, we had TMG, IPA, Anaheim, Downey, Long Beach, so on and so forth. So those are now collapsed, and we only have 3. So that makes it easier to kind of comprehend the network. So today we have South Coast Anaheim, South Coast LA, and South Coast Orange County, and what this really means is a hospital. So Anaheim goes to Anaheim Regional. LA, we have Lakewood Hospital, and then for Orange County, we have both Fountain Valley and Orange Coast Memorial. And so basically the pods, and some of you may or may not have encountered this, but at some point, sometimes if a PCP was in, let's just say, the Anaheim pod, the specialist of interest was in the Orange Coast pod, there would have been some complexities with having the patient access the specialist and the PCP of choice. So we were looking to kind of make that whole navigation easier by making less pods, creating hopefully less confusion. There still may be some of that, and that specific example that I just get, there may be a scenario where a PCP and a specialist are in different pods. But the idea is that we, at least to some degree, make it a little easier to navigate. And the reason for that, as I mentioned earlier, for these pods is so that patients can stay within the borders of their cities and aren't traveling too far. Orange County being a large area, we felt the need to make it three pods. So that's good news. And if you have any more questions on that, I'm happy to answer questions at the end of the presentation. Next slide, please. So HealthCare Partners, another selling point, I think, for all of you and your clients, that we offer the full gamut of Medicare Advantage plans to consumers. So from United HealthCare all the way down to SCAN, I won't name them all, but we're really partnered with everyone. And we also have special plans that are only available to healthcare partners. For example, Plan 2 with United HealthCare is exclusive with us. You can't get that, at least in LA, not in Orange County. You can't get that unless you're enrolling with healthcare partners. SCAN, same thing. They're exclusive to us in the South Bay region. They do not contract with anybody else. So we're pretty excited about that. I think that shows the health plan's allegiance and the health plan's appreciation for our quality metrics and outcomes. So again, we have the full gamut of partnerships as it relates to Medicare Advantage. Next slide, please. So let's get into what most of you probably want to learn, marketing support and services. Next slide. All right, so we have a full marketing team, and you can view us as your partners. There are 2 managers, Patricio and myself, and then in each market we have 2 coordinators, and each of the coordinators is responsible for really being a support to the supervisors. I was going over the footprint with all of you and letting you know how many group sites and how many PCPs we service. We as a marketing team service both segments, so we have quite a footprint to cover. And our accountability is to grow the senior line of business. So we work with the group, we work with the IPA, we work with health plans, we work with brokers, we work with the community. So we're stretched pretty thin. The invitation goes to all of you to get to know us, reach out to us. Let us know if you would like to have some sort of co-sponsorship in the community. We would love to co-sponsor you. But make sure that you're staying top of mind with us. Let us know, call us. We can get the directory available to all of you so that you know who your representative is in the different markets. If you have enrolled a new patient to a specific PCP and there's an opportunity to introduce you, we'd like to make that happen. Next slide, please. So I kind of already segued into this. Warm introductions to our PCPs. So we do that through meet and greets, and we also do group site tours. The best way to really do that is, I'm going to give you guys a quick tip, is 2 ways. One, I indicated, if you have a new patient, let us know. Call us, send us an email. Well, if you send us an email, don't give us the patient's name, obviously. I don't want any of us breaking any HIPAA rules. But let us know because we can introduce you to a PCP if they don't have a broker embedded there. So a little caveat, and I want to make sure that I level set and I set the right expectations for folks. We do honor the existing partnerships if they exist at an IPA office. So at some time or some point when we get to know our PCPs, we find out that they're already working with or they already have their embedded sales partners. We honor those. Unless the physician tells us that they want to meet new partners, we'll go ahead and look for the different partners that might make sense. We'll take language into consideration. We'll take, if they prefer any type of personality style, we'll take that all into consideration and make that introduction. If there are no embedded partners in that office and the doctor wants one, that's where we really want to be able to introduce you guys. And what goes over really well are 2 things. If you've already introduced a patient to the doctor, we can say, look, doctor, this is one of our partners, and they've already introduced the patient to you, and you can bring the patient's name with you. That goes over really well. And then a marketing plan. Our doctors want our help in promoting them. So if you have experience in marketing in that specific region and you have some events that are coming up where you'll get some leads, let us know. We can co-sponsor. We're more than happy to fund you and create flyers for you. And then you can let the physician know that that's how you'll be promoting them as well. So it really shows a collaboration and a win-win partnership. And that kind of segues into the next bullet. We really want to make sure that we're developing win-win relationships, and we do let the providers know to work with our broker partners, give them leads to the extent that they're also getting new patients. So it's a win-win for both sides. Some physicians and some sites do allow camps. Not everybody does. Camps are typically allowed for sites that have either a conference room or physicians that have the space, and obviously at their discretion. We do on-site events at our group sites and even IPA offices if the space allows, and if there's interest, we can do bring a friend types of events, and we like to do some sort of mass advertisement to get the masses or get the leads or prospects to the event. So to the extent that you're working with us, we can collaborate. And as far as community events, I kind of touched on that already. We can do Medicare 101s or dual presentations, offer screenings, or actually we are revisiting the screenings because we know you guys wouldn't be able to sell. So we can either eliminate the screenings and do giveaways, or partner where you have a booth next to us, and we offer the screening and you guys can do the enrollment. So we can get really creative. It's just a matter of developing the communication and working together. Next slide, please. So these are just some of the sample materials that we generate. We don't necessarily put the agent's photo there, but we have a different template where at the very bottom we can populate your date. So if you have an event going on at ABC Senior Center, we can put your date and advertise or promote your specific event. Next slide, please. We won't get into this, but this is just a physician testimonial who has been very appreciative of the approach that we deployed. And so, next slide. All right, next slide. Our value-added services. Can I get the next slide, please? So we have a few value-added services, and I'm not going to be able to get into all of them because we'll be here for a bit. But the value-added services are really enticing for your clients. This is what they get that kind of sets us apart from other folks. Starting with the first bullet, patient experience. Can I get the next slide? Next slide. We can go ahead and move through. Next slide. Next slide. There you go. So our patient experience, we developed this WellPack piece as a means to help the consumer stay organized. So if you would like a sample of it, please let us know and we can make some available to email for distribution. But basically, and the inside is pre-tabbed, and you can see the tabs at the bottom of the screen there where it says WellPack tabs. So the patient has an opportunity to store their test results, immunizations, any medications that have been prescribed, any referrals that have been ordered, their health and wellness kind of path, anything and everything that has to do with their care is pre-tabbed for them to keep in this portfolio. And it really has helped improve patients' overall accountability for their health, so there's better outcomes. Patients we found more retention, which is good for you guys, good for us, and good for the patient in the end. And the health plans love it because it did improve P4P and STAR measures. So overall, this tool really was beneficial for all parties. And we also learned that the family members really loved it because they get to open it and see what's going on with their loved one rather than kind of being in limbo and asking their mom or dad what else is going on. Because oftentimes they'll say, oh, I don't know. I don't remember what the doctor said. He said I have to see some specialist, right? And they don't really give the details. So having all of the concrete data inside this portfolio made it really easy for loved ones that are kind of caretakers to some degree. Next slide. The patient online portal is self-explanatory, right? So patients have an opportunity to jump on this and view their lab tests, schedule their appointments, prescription refills, even securely message their doctors. Huge advantage for those seniors that are kind of internet savvy. Next slide. Health enhancement. This one's kind of one of the exciting things, at least for me. We have two approaches to our health enhancement offering or our program, and one is that first and foremost, it's either free or very low cost to non-healthcare partners patients. Actually, to healthcare partners patients, it's entirely free. And we also do one-on-one appointments with a nutritionist. So if you're not a healthcare partner, it's $50. If you're a healthcare partner patient, it's free. But basically, if you have diabetes, if you have weight, a concern about your weight, if you're a smoker, anything that has to do with your health, we can kind of sit with you and give you a path to get you on the track to health or manage your ailments. And we've seen great outcomes with this. We have even deployed cooking classes for kids because we saw that child obesity is such a huge thing now. So it's been really fun for children, and some of the grandparents even join in. So health enhancement is a definite kind of distinctive competency of healthcare partners as it relates to other medical groups. Next slide. Our urgent care centers. So I indicated it, I think, in earlier slides that we have 20 all throughout California. If you come to a healthcare partners urgent care center, and the new location that I mentioned moved, the Fountain Valley office, which is now being called Harbor, that's an urgent care center. We also have walk-in clinics, Anaheim's a walk-in clinic. We can get you the grid if you guys would like it. But basically, if you come to a healthcare partners location, the PCP, or I'm sorry, the co-payment would be that of a PCP, whatever's on the benefit plan. So if the PCP visit is a zero, the urgent care visit would be a zero. We honor that. Next slide. Comprehensive care centers. So this is another distinctive competency of Orange County. I'm sorry, of healthcare partners. Not yet available in Orange County, but we are looking at deploying it. I think we're doing a part-time offering at the Harbor office. Not the full gamut quite yet. But basically, the comprehensive care center is a beautiful, beautiful concept that really helps the patient from a full kind of one person, one team program perspective. So in one same facility, we have a psychiatrist, a psychologist, a psychiatrist, a PCP, different specialists. We have a full care team supervisor that does a full assessment with the patient to understand what really is going on with the patient, if it's drug abuse, if it's something going on at home, for different ailments, if there's multiple comorbidities where it's COPD, diabetes, that makes it really difficult for the patient to manage their ailments. It's by referral only, but it's just a beautiful thing because it's a full team of nurses, as I indicated. We even assess the home situation with a social worker. We have a registered nurse, and it's all in the same location. And we basically keep the patient until either their benefit exhausts or they're kind of they have a handle on their ailments. Next slide, please. Our patient support center is open 24/7. So if the consumer or the client has any questions on health plan eligibility, where's the nearest urgent care center, I'm having trouble breathing, anything really, even sharing a compliment or a complaint, we're open 24/7. We want to know. And we have nurses on board to answer anything clinical for a group patient. Next slide, please. So in summary, we kind of I threw a lot at you today. So in summary, we talked about our hospitalists that are actually employed and stationed at our key hospitals, ensuring that the coordinated care model is operating well and that the PCP knows what's going on with the patient every step of the way. Our patient liaisons are the patient advocate at the group site. So we talked about group and IPA, and at the group site, we have a patient liaison who onboards the patient, does a welcome visit. It's the patient's go-to. The patient never has to wonder who to call. They always have their patient liaison, which is wonderful. The clinician network liaisons are provider relations folks, and they're working with IPA providers. So IPA providers also have their specific team. And I covered the 24-hour nurse support and patient support center, for your low-cost health enhancement classes, and the urgent care centers and comprehensive centers. So that kind of gives you an overview of our support and services. Next slide, please. Okay, next slide. Last but certainly not least, the growth opportunities for us currently are really three-pronged. We have agents, C-SNPs, and Medi-Medis. Of course, I'm going to jump really quickly just to Medi-Medis because I think that's the one that we're all kind of touching on, especially since we're on the brink of the launch here in Orange County. As it relates to Medi-Medis, our approach is to educate the community and the providers. So we all know there's the Medi-Medi Orange County Connect kicks off here in July in Orange County. And there's one health plan offering for the consumers. So our whole goal is not to necessarily derail consumers from electing CalOptima or the OneCare network should they decide to, but just letting them know that they have options. And patients have, one, found it very confusing, kind of taking the lessons from the Los Angeles market. They found it very confusing. Folks didn't respond to the blue envelopes that were being mailed to them. They were ending up being passively enrolled, oftentimes to different doctors that were not the PCP or specialists that they had been visiting for years or for a large amount of time. And so that's basically the message is for us to the consumer and the PCP is to educate and let them know what their options are. Really quickly on the agents and the CSNP, we have a full agent program deployed for groups. For IPA, we really can't do much. Our compliance department doesn't really allow us to do much on the agents for IPA. But we do talk with the providers and let them know that if they have an interest, they can let their agent patients know to come to different Medicare 101s going on in the community. So this goes back to what I was mentioning earlier. Let us know if you have Medicare 101s going on in the community because we can create flyers. I give them to IPA doctors so that they can let their patients know where to go to get the information that they need. And it's the same message for CSNP. So patients that have obviously diabetes or COPD or CHF can benefit from a enrollment opportunity all throughout the year and richer benefits. So it's the same message. Can I get the next slide, please? And then you can just go ahead and forward. I kind of covered all three of them in one. Next slide. Next slide. Next slide. Next slide. Okay, so we're wrapping up here. Collaboration opportunities. I wanted to highlight and invite those folks that are active in Orange County. We are hosting a Partners in Change event. So lots of moving pieces with Comedy Connect. It's a time of change for providers and consumers. And so we're inviting those folks that enroll or work in Orange County to come meet us, meet the marketing team, meet our operations team, our group, site administrators, and the patient liaisons that are at the site, the IPA team, and spend an evening with us, learn about Comedy Connect, and let's get kind of prepared for it. That is on June 25th, and it's from 5 to 8, and it's in Anaheim at the Hilton. If you're interested in attending this, please let Emmanuel know so we can get that invitation out to you guys. Next slide. Another way that you can collaborate with us is through our meet and greet. Our designated doctors are the doctors that we focus on the most. And if you would like to be added to the meet and greet invitations, again, you'll want to work with the supervisor in that specific region. And if the doctor does not have a broker embedded there, we'll be more than happy to invite you to the meet and greet. Next slide. And right before open enrollment, we have our Survivor Kickoff events. If you haven't attended one, I highly encourage it. They happen right at the beginning of open enrollment in October. We have them in the North region and in the South. And we bring our doctors, we bring our operations team, both on the group and the IPA side. We'll give you guys a quick update on HealthCare Partners and hopefully send you off to open enrollment with a lot of fun. And that's it. I think that wraps up the presentation. Next slide. Can I answer any questions? I don't know if we have any time left.
All right. Thank you so much, Ruby. Guys, just before I say something, right on the top of your little control panel, there's a little box that looks like a little chat box. You can put in some questions for Ruby there, and we'd be more than happy to have her answer that for you. I'm not going to unmute all the lines because obviously there's a lot of feedback sometimes, and it hurts my ear. So if you guys can go ahead and write your questions in those boxes. Ruby, thank you so much for your time. I know personally I've had a lot of experience using your facilities, and my parents as well. Both of them use your facilities. Does that well packet come in Spanish inserts or only English?
It only comes in English, and we've had that question before. Unfortunately, we're not looking at deploying them in Spanish. So yeah, it just comes in English.
Okay. You think I could get a couple of you for my parents? They're already members of HealthCare Partners.
Of course, I would love to give you that. Yes.
Awesome. And guys, we also have HealthCare Partner has a couple events coming up. I know there's one tomorrow, which you should have already RSVP'd since last week if you're going to attend that one. But if for some reason you didn't get a chance to RSVP for that one for tomorrow, you can feel free to shoot me an email, and then I can see what I can do about trying to get you in there. If not, then there's also one on Thursday, and then there's a couple more in about a week and a half. All those events are on the event calendar. If you go to teamalvarez.net, under the About Us tab, there is the events calendar. You can look at all the events. Specifically, there's 4 coming up for HealthCare Partners this month, and you can RSVP for that as well. And then throughout the year, throughout the months, HealthCare Partner has a lot of different events that you guys can take a part of. Ruby, just from your experience, what can you suggest to the agents as far as how to access doctors and how to, just in general, how to be able to start, networking or marketing to doctors?
I would recommend getting in touch with our supervisors. So in my region, for example, I have one supervisor. Her name is, in Orange County, her name is Joanna Cazares. In Long Beach, I have Rosa Phillips. And then in South Bay, I have Gilbert. I can get you a directory of all of the supervisors so that the folks in that work in the North region in San Gabriel Valley and in San Fernando and downtown LA area know who their representative is. But I would start with developing a relationship. We're in the relationship business, right? So developing a relationship with the supervisor of the region first, and coming up with a joint maybe marketing plan, I would say, for specific physicians or a specific region. So if the agent works in a specific area of Santa Ana or Anaheim, I would call Joanna and I would say, hey, I work in Anaheim, I work in Santa Ana, I have a relationship in these senior centers, or I want to work in these senior centers. Can we consider can you co-sponsor me? Can we co-brand? Can we work with to promote some of your group or IPA doctors? We want that win-win partnership and start promoting our physicians together so that when we go and introduce the agents to a physician, we can say, hey, doctor, here's a great agent that wants to work with you. We're going to collaborate to promote you and get you some exposure in the community. And the reason I really push for that whole marketing plan is because our providers look to us to help them grow. So we always encourage the providers to give our partners leads. So we tell the provider, hey, Dr. Smith, when you have a patient that's aging in or is looking for or has questions on Medicare Advantage and their options, please let Emmanuel know so that patient knows who the resource is. So we always look to make sure that we get our partners leads. Conversely, we tell the doctor, this is your partner. He's also going to help you and help us grow, Dr. Smith. So let's work together to make sure that it's a win-win partnership. Does that make sense?
It does. And, I already know the answer to this because I've used you in the past, but how easy is it for an agent to set up like a Medicare 101 or a speak with a doctor or have a doctor present? How easy is it to approach you guys as managers to find a doctor that is willing to do some speaking events and stuff?
Oh, that's an awesome question, Emmanuel. I love that one. I would love to get you a doctor at the drop of a hat, but the doctor's schedules are sometimes, they're not my own, right? So what we're finding is that at least a 30-day notice is preferred. It doesn't mean that you can't call us and say, hey, I have an opportunity for a speaking engagement in a week. Try us. We'll do our best, But just know that the doctor's schedules are probably booked. They're probably already scheduled to see patients. So 30 days helps us a little bit. The more notice that we have is better, obviously. But if we could maybe work on short notices, we might be able to even get like a nurse or someone else. It just depends on what we're able to pull.
Awesome. Okay. All right, let's see what kind of questions we have here.
I see. Is there any representation in the Central Valley, Fresno, Madera area? No, we don't. We don't stretch that far north. We really go as far as, oh my gosh, you're going to test me right now. The Antelope, I don't know how to pronounce this one, Antelope Valley? I know I'm not pronouncing it right. I think that's as far north as we go. So that whole kind of Ventura, Antelope, geez Louise, I can't say that word to save my life. Antelope Valley.
Antelope?
That one, yes.
Okay. Well, viewer 17, the same basics on approaching doctors and working with them and marketing stuff will also apply in your area as well. It just doesn't necessarily have to have be healthcare partners who's not in your area, but you can use the same approach and the same type of develop a system of marketing with the doctors and develop steps that you can use every time, and you can refine them every time. Any other questions? All right, Ruby. Thank you so much for your time. I know you're very busy. You're always running around and everything. So thank you very much for taking some time and training our agents here, and teaching them a little bit about what HealthCare Partners is all about and stuff. And all right, guys, we're done. Thank you very much for joining us.
Thank you so much.